Hi, my name is Andrea. I've been an X-ray tech for 18 years, and I've been asked to talk to you about how TLR's kind of affected my life and my career. When I was first trained in moving techniques, it was very focused on patient first. We were expected to move very, very quickly without any thought on how it hurt our bodies. I specifically remember being taught a technique where we lift a patient out of a wheelchair with two people, lift him up and have a third person in the back, just in case that patient tipped over backwards. It's a little sketchy. By the time I was 25, I had been taken off work with a back injury and a knee injury, both occurring on two separate occasions at work. By the age of 35, I was diagnosed with arthritis in my right shoulder. The doctor tells me that this was caused most likely by repetitive stress injuries. I had surgery on the shoulder last year, and it is still bothering me, and it will most likely bother me for the rest of my life. I took the TLR Train the Trainer course about 2 years ago, and my eyes were opened. The focus is no longer entirely on the patient and the speed to get the move done, but now we focus on planning a safe ergonomic move that should not hurt the patient or the staff. I was taught to slow down and plan before jumping in. I have to say that although I saw this change as positive, I was very concerned about bringing it back to the department. Many people have been doing things one way their entire career and are very, very against change. It's hard to convince them that change is good. The newer staff are also not always comfortable saying, "Oh, wait, stop, let's do it this way." So I was pretty nervous about bringing this one back to work. I happily found that this new TLR attitude quickly gained momentum. In X-ray, we're faced with many challenges that are not addressed in the typical TLR training. None of us ever took it seriously because it was so focused on nursing, and none of it ever covered any of the moves that we routinely do in X-ray. My team was constantly challenging me with finding unusual solutions. I found working out these problems actually solidified us as a team because we worked them out together. One example is we use slider boards all the time to move patients from stretchers onto our X-ray table. In order to move from a stretcher onto X-ray table, we would have to either reach across the X-ray table, grab onto the slider board and pull it, or climb up onto the X-ray table, grab that slider board, pull it a little bit, pop off, and then pull it the rest of the way. Not exactly the safest way, but it was the only way we knew how. So we ended up finding some straps that we can attach to the slider board, and then we can just grab the straps and just do a simple weight shift, and it slides that board right over. It's very safe, it's very fast, and it's actually smoother for the patient. Genius. Since then, other departments have inquired about our straps and are working on their own solutions. Our most recent TLR challenge arrived a few weeks ago in the form of a mobile CT scanner. This thing presented many challenges. It came with a small stretcher whose height cannot be adjusted while the patient is on it. So it stays this height. We have to match everything to this. It also comes, you have to go down this tiny little narrow hallway with that stretcher. You go up over one bump and then wrap around the corner this way. There's another bump to go down here, and then we have this tiny narrow hallway that we have to get that stretcher down. And we have to get it up on this ramp. This ramp has a very steep slope. So if you get the stretcher up and at the wrong angle, the stretcher tip over. If you don't have enough speed to get up, you just stop. So you have to practice to get it up and around the corner just the right way. So our staff took this challenge and we practiced and practiced and we practiced. We worked out every scenario that you can think of. What if there's a patient on there who's being bagged? What if this happens? What if this happens? They worked it all out. They all took turns being a patient on a stretcher. They all kind of felt what this lift felt like, what it felt like to get up there. When you're getting up there, the stretcher actually does lean a little bit until it's settled. It's quite scary. I know that 2 years ago, we would have just got this mobile CT in and put a patient on it, someone would have been hurt, right? Whether it's the patient flipping off the stretcher or one of us trying to catch that patient, because that's what we always do, right? Catch first, think later. I'm positive that would have happened. So I'm happy to say that TLR has made a huge positive impact on our department, and I look forward to helping develop TLR programs to tackle unusual situations not typically covered in the general TLR training. Thanks for listening to me.